Hello, good day. Let's now discuss the how to treat dehydration secondary to diarrhea. So these are the references. So types of diarrhea that can cause dehydration is secretory. We have osmotic and malabsorption, inflammatory mostly because of infection, and exudative type of diarrhea. So we must determine the dehydration status of the patient. If with diarrhea, then there is really a watery stool, and if the patient fluid deficit is more than 5 to 10%, so patient have mild to moderate dehydration. If greater than 10% of fluid deficit, then severe dehydration. So just note the signs of dehydration, like if the presence of tears, if there is decreased tears, so it is mild to moderate. If no tears, so severe dehydration. And also note the alertness or the condition. If restless and irritable, so maybe mild to moderate dehydration. But if lethargic or the patient will not move anymore, then maybe severe dehydration. Also, the capillary refill time or the cutaneous perfusion. So if the capillary refill time is around 2 seconds, so it may be mild to moderate, and if greater than 3 seconds, severe dehydration. Okay, so if the diarrhea is non-infectious, so we can just correct the dehydration by giving um, oral rehydration solution. So we can also give racicadotril for acute diarrhea, and also loperamide for adults, and zinc for pediatrics and probiotics. This is how you will make the oral rehydration solution. Homemade, if you cannot buy this one, the prepared ones in the pharmacy, so you can actually make a oral rehydration solution by getting 1 liter of water, 1 liter water, then 4 teaspoon of salts, uh, I mean sugar, and 1 teaspoon of salt. Some of the references will make this 6 teaspoon of um, salt, sugar. It's okay, and but it's only 1 teaspoon of salt in a 1 liter water. So you replace by giving, if the dehydration is moderate, so you just multiply the weight of your patient. If moderate dehydration, so if the weight is 10 kilograms, so 100 times 10 is equals to 1,000. So 1/4 of the 1,000 ml will be given in the first hour, and the 3/4 of the 1,000 ml will be given at the for 7 hours. Okay, so this is the Malcolm Holiday protocol. We can also use this one for assessment of degree of dehydration. So if no signs of dehydration, continue diet, give fluids as tolerated, then replace ongoing losses with oral rehydration solution. If less than 2-year-old, 50 to 100 ml ORS after each loose stool. For 2 to 10-year-old, 100 ml ORS after each loose stool. For greater than 10 years old, then as much fluids as the patient wants. If mild to moderate dehydration, so approximate amount of ORS required, weight in kilograms times 75 ml, given in 4 hours. So if the weight is 50 kilos, so you multiply it by 75 ml, then the result of the volume is will be given for 4 hours. Replace losses with ORS. So if less than 2-year-old, 2 to 10-year-old, and 10-year-old, these are the following um, dose of Orisol. Reassess degree of dehydration. Repeat treatment as necessary up to 2 cycles. So if ORS is tolerated, continue. But if ORS is not tolerated, then ORS administration via NGT if you are not in the hospital but you are only in the health center, local health center. So if the ORS is really not possible oral radiation solution, you need to go to intravenous fluid. So you replace the dehydration by using the isotonic zero 0.9 plain NSS or plain LR, plain NSS or plain LR, using the 75 ml per kilogram, infused in 4 hours intravenously. So infused in 4 hours. Be sure also to assess if there is no any comorbidity like congestion or other problems in the heart. For if ORS is tolerated, then go back to ORS. If not, then repeat the hydration. So assessment of dehydration. If severe dehydration, so this protocol will be used, given over 3 to 6 hours as follows. For a less than 12-year-old, 30 ml per kilogram for the first hour if severe dehydration. For 12-month-old, then 30 minutes. The 30 ml per kilogram will be given for 30 minutes intravenously. Then give 70 ml per kilogram for 5 hours for severe dehydration, and 2.5 hours for 12 months and above or 1-year-old and above, 70 ml per kilo. So evaluate hydration every 15 to 30 minutes until hydration improves. Afterwards, reassess every hour. Okay, still with severe dehydration, so go back with this one. But if the dehydration is moderate, so go back with this 75 ml per kilogram in 4 hours. And for mild, then this is the computation for mild. Okay, so I think that's it. So for Haliday-Segar method, we've seen it a while ago. And for modified Finberg method, this is the fluid per day for the maintenance calculation of the maintenance fluid requirements. Okay, so for supplements, you can use supplements like probiotics, lactobacillus, if non-infectious, given to children or to adult if non-infectious, but or to avoid recurrence. You can also give it to infectious diarrhea also. Zinc supplementation also is recommended to prevent acute infectious diarrhea among children 6 months to 12 years old, but not be given in less than 6 months old. Not be given. Vitamin A supplementation may be given to children greater than 6 months to reduce the incidence of acute infectious diarrhea. The recommended dose is 100,000 IU every 4 to 6 months for infants and 6 to 12 months. So 200,000 IU every 4 to 6 months for children greater than 12 months. Low quality of evidence. If the diarrhea is secondary to infection, so we use this antibiotic. It depends on your doctor which antibiotic should be used. So if traveler's diarrhea, if the doctor considering for traveler's diarrhea, then ciprofloxacin or any fluoroquinolones should be given for 3 days, 3 to 5 days, 2 times a day. So for traveler's diarrhea, or for salmonella, campylobacter, or bacteroides, or vibrio. For febrile invasive severe dysentery, with bloody stool, secondary to campylobacter, salmonella, fluoroquinolones, the same management. But if the diarrhea is because of giardia or amoeba, Entamoeba histolytica, then you use metronidazole 3 times a day for 7 to 10 days. For bloody diarrhea, suspected Shiga toxin producing E. coli, so no anti-motility or antimicrobial agents, as they may worsen the risk of hemolytic uremic syndrome. So do not ameliorate the STEC. So no anti-motility or loperamide and no antibiotic. So that is the characteristic is bloody diarrhea, painful but no fever. So just correct the dehydration. So these are some of the infectious diarrhea and their treatment, other treatment. So please read this one. That's it. Thank you.